Right, our final speaker is, we've got a very international flavour to today. We've got people from all over Europe have come to join us. Effie here is from the Netherlands. We also do have a Russian contingent here today and two Greek people as well. So a very international day. So this is Effie Papadopoulou. She's a psychologist and she's going to be talking about psychological impact of aniridia.
Try and keep close to the microphone. Woo! Go on, off you go.
Good afternoon. This is my first Aniridia conference, and I'm really glad to have flown from the Netherlands to be with you here today. My name is Effie. I am a psychologist, and my daughter Sofia has aniridia. Today, for a change, I would like to talk about the parents and not the people that have aniridia, because the parents also are affected greatly by aniridia diagnosis, and I think it's something not talked about at all. When Sofia was diagnosed in 2010, that was a really hard time for us. Like it happens in most cases, her diagnosis was delayed, and due to the lack of knowledge and information on aniridia. Although we repeatedly raised the issue of photophobia with our newborn baby, with a couple of pediatric doctors, we were met with dismissal and denial of any possibility of any problem with Sofia's eyes. So we were sent home. When finally we were told that Sofia has aniridia, the doctor was unable to give us any kind of useful information or support. He told us that Sofia would eventually go blind and there's nothing we could do about it. Like Fern said, we were filled with a lot of fear and stress and anxiety. We were totally alone. No one could guide us through our confusion, isolation, and we didn't have access to any kind of emotional or psychological support, network, peer groups. We didn't know of any aniridia organizations and all the names of actual doctors who are knowledgeable on aniridia. Rare diseases are often, like you all know, complex and chronic and life-changing, but they affect the whole family and not just the person involved, also the siblings. Although its rare disease is different, the difficult challenges faced by the families are usually similar, no matter what the diagnosis. For families whose children are diagnosed with sporadic aniridia, the condition is totally unknown before that, and that causes a lot of fear for the child's future, feelings maybe of guilt, depression, and a lot of stress. For many parents of a child with a rare disease, the burden of care spans a whole lifetime, and it's a lifetime commitment. In many times, it requires a change in work pattern or even job loss, income reduction, and extra domestic responsibilities. This often results in a lot of pressure on the parents and a shift of the whole family dynamic. Parents will require specialist health literacy, caregiving skills, and resources beyond those normally required by parents in general. Diagnostic delays, which are common, add up to the frustration faced by parents at the time of diagnosis. Obtaining one as fast as possible is a determining factor for proper medical and health care, which can include symptom-driven treatments, prevention strategies, and avoidable unnecessary interventions and surgical procedures. Moreover, rare diseases are very difficult to diagnose, and with a lack of skilled professionals are also very difficult to treat. The mental strain becomes too much for most parents, which results in a change in mood and behavior and signs of depression. In a condition like aniridia, a multidisciplinary team is often required, as you all know. This was a first for us, an impossible task, coming from Greece. In Greece or even in the Netherlands, there was not even mention of any other professionals that could help us with the side effects of aniridia, or they were familiar with aniridia itself. The moms that have talked to me about the children have all also reported different medical problems they had to deal with that required the help of varied professionals. The time a family needs to devote in getting the care and information the children require is a massive investment of the kind that can cause a lot of stress, to say the least. Being given the sudden news of a rare disease without a cure can be extremely devastating for parents, and them having no support, it makes everything even worse. The experience of frustration will also be felt by the siblings and the whole family in general. You know that when the parents are not feeling good and they're feeling stressed and anxious and depressed, they're also unable to seek the right treatment for the children and the right diagnostic tools. This emotional roller coaster is overlooked. People are talking about all the patients with Aniridia, which is the first priority, but the way the parents are feeling about it is totally ignored. It's not given any attention whatsoever. The impact of Aniridia on parents' mental health is neglected, and parents feel alone, not understood, scared, and in the end, isolated. I've talked to many moms, unfortunately, in Europe, in the UK, and also in Greece, in the Netherlands, in Italy, that had to go through a lot of stress, a lot of isolation, total depression, not knowing any information whatsoever, because when the child was diagnosed, they were given no support whatsoever or guidance towards the right professionals that are supposed to help them. The focus naturally is on the aniridic children, and better treatments, new research, and information on doctors. And in-depth discussion of daily struggles takes priority, and the mental status of the parents in the groups is often overlooked and not addressed. As parents, we all know that the way we feel directly affects our parenting abilities. Being a parent is a very challenging and at times very stressful job. Parenting a child with aniridia adds additional strain on families, like people have talked here before, the psychologist that was on, and also Fern. When we feel down and unsupported, desperate for answers, and worried about the child's future, it's extremely difficult to be able to focus our energy or resources in seeking the right treatment. The psychological impact, therefore, of aniridia on parents is totally buried. This is my personal research, talking face to face and on the internet, through the internet, with all the parents I know in the USA and Europe that have aniridia, which have told me the majority of information they found on aniridia is through Facebook, which actually is not great at all. So the red bit is the doctors who gave minimum information because they don't know themselves, and the blue bit is Facebook, where everybody's getting the information from, which is great for nowadays, but also not great at all when you get diagnosis and you have to go online. There's many families who don't have Facebook or who don't have internet. Like James earlier said, there's 800 families in the UK, 800 people, and here there are not 800 people here today. So there's many people who maybe have no access to Facebook or the internet or any online resources. And that's really bad. Traditionally, families received very little attention by clinicians or researchers. Thankfully, lately this is beginning to change. There's progress. The Rare Disease UK, as well as Eurordis, you all know Eurordis, are working very hard in order to establish new policies on diagnostic tools and supportive networks for the 30 million people living with rare disease in Europe, also aniridia. Organizations like Aniridia UK, also, and Aniridia Europe and the Vision for Tomorrow Foundation have also managed to bring people closer together, provide essential support and vital communication between aniridics and doctors. However, the progress is great, but is not enough. Moving forward, there need to be guidelines in place for when aniridia is diagnosed. Parents need to have access to a whole range of guidance through emotional support, to psychological support, to doctors that are aware and knowledgeable and real experts on aniridia in every country, aniridia organizations like the Aniridia UK and every organization in Europe, and families should be referred to both qualified doctors and the organizations in their own country. They need to be given information about possible sleep problems, like Iona just said, My daughter also was suffering from sleep problems. We spent more than 2 years with Sofia having fits every morning from being extremely tired because she couldn't sleep at night. And every single doctor we went to told us that there's nothing wrong with her, or maybe she's epileptic. When the problem was that she needed melatonin. And I struggled really, really hard with many years in trying to persuade doctors that she was not epileptic, that she's not sleeping well, and during the day she's very exhausted, and that's why she's acting the way she was. Once we got melatonin, then everything was great and she finally slept. In recent studies that I've been reading, parents of children living with rare chronic and complex diseases have called for better education. That's something we need. Better education on the doctors. Like earlier, they said that there was no support even by medical professionals because they don't have enough and adequate information or education about how aniridia or a visual impairment affects mental health, and education is needed. And ideally, psychological support in dealing with this new reality. Also, there need to be information about genetic counseling. Many people I talk to are not aware that they could have genetic counseling, genetic tests. They don't know where to have them. They don't know how. So they have absolutely no guidance at all. In 2017, researchers outlined that psychological support and genetic counsel should be available to all parents following a rare disease diagnosis. Parents need to be adequately informed and actively involved so they can provide the best supportive and healthy environment to the children. Like the lady there said earlier on, and the gentleman, they had to go through a lot of unpleasant and depressing situations. This wouldn't have happened if their families had received information and mental support and emotional support when they were growing up. Because if parents receive psychological support, then they know how to deal with the children. They're better equipped, they're very educated, they're better skilled to deal with them, and then growing up they will have the same kind of support. But unfortunately this is not happening. An ophthalmologist once told us in Greece that Sofia is colorblind and that all aniridics are colorblind. And that added a lot of stress to me and my husband and our family, and information which was totally inaccurate. Sofia is using color to guide herself through things. Color is very important to her, but this was a very good ophthalmologist in the Netherlands who told us that all aniridics are colorblind. Such a misguided information that caused so much stress and anxiety in our families. I feel hopeful that in the future, no more parents will have to go through what Fen's parents went through, what I went through, and all the other parents I know that actually live alone in silence and they're not giving any attention whatsoever about the difficult task of learning that the child has a rare disorder with no cure that could make them blind in the future. And this is extremely distressing when you don't know. Because once you know and you have knowledge, then you feel better. If I knew that Sofia would become 8 years old and she will do horse riding and ballet, and she speaks 4 languages right now, she reads and writes in English and Dutch, and speaks fluent Greek and Italian, and she's galloping really fast with her horse and cycling everywhere. And I couldn't believe it when she was diagnosed. They told us, go home, she's blind in a few years, I'm sorry. And if at that point somebody told me that there are problems, but there's hope, and she can do everything she wants to do, I would have felt so much better. And rather than going through the worst time of possibly my life. And I hope that in the future this will not happen to any other parent, and this is something we need to change. Every GP, ophthalmologist in Europe, and eventually in the USA, when they get diagnosed of aniridia, they should have a guideline, where they should guide you through, I didn't see that. They should guide you through all the experts that you need. Possible sleep problems, sensory problems, cataract problems, psychological support, emotional support, and everything you need, so you are much equipped about this. And I hope that our children and the future generations of children, because we see now with the internet, we communicate with each other, and we see more children with aniridia coming up. It is a rare disease, but affected by many people. And there's a lot of children, and the future generation of children should not have to grow up like the previous generations, with no support and feeling like the end of the world is here and they can't do anything, they're just disabled, and that's the way to stay. Thank you very much.
Any questions for Effie?
I'd like to say thank you. I mean, that was a good experience.
Go back to the mic.
Sorry, can you hear me now?
Yeah.
I wanted to say thank you. I wanted to say that your experience probably mirrored a lot of our experiences. I'm a British girl, but I spend a lot of time abroad in Southern Europe, and unfortunately some of the systems are not in place, and sometimes you have to be up for a scrap, let's say, to get things done for your kid. But the flip side is, I feel like, having returned to Britain, I feel like a lot of my stress is gone, because there are some wonderful doctors here and they do help you out. So if you're not aware of that, I know that sometimes we struggle with things going on here. There is a big flip side to, some of the other people who are living abroad that really have to go out and seek these people and pay for them out of their own pocket, because they're not available on the NHS. So thank you for that.
You're welcome. Thank you very much for saying that, because I think that the parents of usually sporadic aniridia mostly are not very represented at all, and they're going through their own depression and struggles every single day, and especially the time of diagnosis, and nobody knows about it. They cannot talk to anyone about it. The attention is on the children and they're left out. But feeling like that, they cannot be as good as possible they can be and give the best treatment that the children deserve. I had a lady phone me from the Netherlands, because now I'm the representative of the Netherlands in the UK in Aniridia, and she was in Amsterdam, and she phoned me crying on the phone for 25 minutes, totally desperate, telling me they just got the diagnosis of aniridia. They were feeling absolutely depressed. They thought the end of the world is here. She was crying on the phone with her husband, who was also crying. And I was trying to calm them down, and they're saying, that's it, I just gave birth to my perfect daughter and she has something that could make her blind. I am desperate. And I felt so sorry for her, and I hope no other parent have to go through this again. If there's a communication between us, then this doesn't have to happen. Thank you.
Can I say just a comment? James.
Yeah.
This is why we're always saying the patients' organization is really important. The country who've got the patient organization, like Aniridia UK, Aniridia Spain, Aniridia whatever, Italy, Aniridia Germany, Aniridia Russia. So all this organization try to do this kind of job, that inform the patient about the doctors, to give patients and give parents the confidence, give them support, gives them strong hand. So this is our role. And the country, I'm really sorry for the country who has no organization. They're really trying to survive, and it's true.
Yeah.
So this is why sometimes they join different countries, whatever, or join Aniridia Europe itself. It's what happened with you.
Yeah.
So the role of patient organization is really big and really important.
Thank you. My information was mostly from Aniridia UK, because there's no information absolutely at all in Greece. And my first information I ever got was from Aniridia UK, because there was nobody in Greece that could help me through this at all. So you're right, yeah.
Hello to everyone. I'm Olga. I came from Greece just to spend these important hours with all of you, because these hours for me will help me to continue the rest of the months, because at the next conference I'll be there again with you. I want to thank you, Galina, you, Effie, and other people, mostly both of you, because you were the first person, the first voices that make me laugh and hope and dream and feel that, okay, we are rare, but it's okay to be rare. Mm-hmm. Most of the diseases are not rare, but it's dangerous and difficult. Here it's rare, but it is okay to name it. And James, I need new lyrics to make a new Aniridia song with video for the MTV.
Because you criticize
Right?
me a lot.
No, he knows what I'm saying. I use the lyrics to make a new video for MTV, right? Thank you all again. Hope to see you at the next conference.
I think it's worth saying, in many ways we're very proud of the fact that the trustees and many of the volunteers of Aniridia Network have Aniridia themselves, and we've always prided ourselves on that. However, it is notable that we have had very few parents be trustees or kind of other volunteers, and so I think there is something there in terms of we always try and address both elements. We don't want it to be just a patients group. We do want it to be for everyone, but there is an element of if the leaders are of one kind, then it's kind of easy to not pay attention to some of these. In a similar way that Mary has made a point about sort of older people and losing what sight you have at a certain stage and the kind of impact of that. So we just want to make the point of please come forward and help out and create. We've had it on our to-do list for ages to create a new parents pack, but someone needs to do it, and you are the people who are best placed to do that, not us. So it's just basically a call to get involved and make all these kind of things happen.
Mm-hmm.
That's it.
Thank you very much.
Thank you.